Welcome back to part 2. We were talking about ophthalmic anti-allergic agents and decongestant agents, and we had just gone through this slide. Some examples of these medications might be Opticrom, Alamide, Pantanol. So cromolyn sodium alleviates symptoms by preventing histamines from producing allergic reactions, and it relieves the tearing, itching, redness, and discharge related to allergic eye conditions. So ophthalmic staining agents. Our chief agent here is the fluorescein sodium. It's used to diagnose corneal epithelial defects and to locate foreign bodies of the eye. Also used when fitting contact lenses as a dye for the retinal studies and for ophthalmic angiography. Now let's look at the ear. The ear is a sensory organ for hearing and for equilibrium. There are three major parts: the external ear, the middle ear, and the inner ear. The two main parts of the external ear are the auricle and the external auditory canal. The tympanic membrane or eardrum separates the middle and outer ear, and ear disorders may cause vertigo or ataxia. What does vertigo mean? It's a sense that the environment or one's body is revolving. It's almost, you feel dizzy, but it's more than dizzy because it feels that the environment around you or you is revolving. And ataxia is difficulty maintaining balance. So when you're walking, if you are struggling keeping your balance, it's kind of like when you stand on a balance beam yourself. Have you ever been on a balance beam and kind of you're trying to keep that balance on that little beam? That's what ataxia feels like. All right, let's move on. Some typical ear conditions. We see a lot in the general practice and in pediatrics, the earwax accumulation. We also have the furuncles from infected hair follicles, inflammation from seborrheic dermatitis or psoriasis, otitis media, which is a middle ear infection, and tympanic membrane perforation. These conditions may range from minor, which they might readily respond to over-the-counter medications, to those which affect the middle ear and can produce pain, fever, malaise, pressure, and even hearing loss. And in these cases, typically need to be seen to make sure that they don't have an inner ear infection and that it's not caused by bacteria. Because again, we can have an infection that is viral. Say we have a cold and it's a viral infection, and through the mucus building up and the fever and all of that, you can then develop a secondary infection. So you could have a middle ear infection that is caused by bacteria and can be treated by an antibiotic. Let's look now at some otic preparations. There are drying agents, anti-infective agents, which inhibit or kill bacterial growth and reduce swelling and promote drainage of external ear infections. There also are corticosteroids that suppress symptoms associated with inflammation, edema, and pruritus. And then there's ceruminolytics. These soften, harden cerumen, or also cerumen is known as earwax. Some common side effects of anti-infective agents: they can cause irritation, swelling, and overgrowth of non-susceptible microorganisms. Corticosteroids should not be used to treat viral or fungal infections or in a person with perforated eardrum. And then the ceruminolytics, hardened wax is common in people who wear hearing aids. So it's important to note if a patient is wearing hearing aids that you will often see that hardening wax, and it will need to be softened or cleaned out because it will block the sound from the hearing aid if the hardened wax is in there. So more otic preparations. We have the ear analgesics, which relieve pain. Sometimes warm mineral oil or sweet oil or glycerin is used. It's important to note not to instill ear medication if ear is not draining. And for a child, we pull the ear down and back, and for an adult, we pull the ear up and back. So that's similar to when we take the temperature. When we're using taking the temperature in the ear, we always take the child's ear and gently pull the ear down and back. And again, for the adult, we pull the ear up and back. Sometimes it's important to explain to the patient also the do's and don'ts that might seem obvious to a medical person when you're working this often. So for example, patients might use Q-tips and they might be trying to get wax out of their ear because they know it's in there and they're really digging in there. But what can happen if they do that? If you guess that they can actually push the wax in and impact it more into the ear, you are correct. So those types of things and giving patient education so that they understand how to take care of issues such as wax is very important. So we never occlude external ear with tight-fitting plug. This may cause the eardrum to rupture because of the pressure. We use cotton plugs. Warm ear medications to room temperature before instilling because, again, it's number one, it's uncomfortable to your ear is the inner body, so it is warm inside of there. Number two, it can cause irritation because it's warm in there and then the cold goes in and it can feel very irritating to the ear. Never use otic medications in the eye. I think this is something that seems obvious, but many times people confuse medications for the eyes and ears, so it's really important to make sure they understand the difference. And medications for vertigo may cause drowsiness, so it's important that the patient knows this so they can plan on when to take the medication and to be aware of that for driving and for working, etc. So vertigo and ototoxicity. This is caused by detrimental effect on cranial nerve and the cranial nerve 8 or the organ of hearing from medications. Affects hearing and balance. We talked about tinnitus is most common sign, that's ringing in the ears. Might lead to severe headaches, nausea, vomiting, dizziness, ataxia, difficult with the equilibrium and hearing loss. And it also mimics another disease. It mimics the Meniere's disease. It's important to note how the ototoxicity can affect hearing and balance because it could potentially lead to falls or accidents and result in serious injuries. So what drugs can be used to reduce ototoxicity? Did you find any in your book? Can you email me what drugs you think can reduce ototoxicity, and I will give you a virtual ticket. So again, the question is, what drugs can be used to reduce ototoxicity? Let's talk about storage of eye and ear preparations. So ophthalmic and otic preparations get easily confused. So it's very important that we don't store them in the same place. Ophthalmic medication requires sterility, and otic medications do not require sterility. Do not store in the same area or the same shelf. Make sure that you check the name of the medication and route of administration more than the usual 3 times, especially checking for ophthalmic or otic labeling. Again, It is common for these to get mixed up, and it's very important that you do more than the 3 med checks when you are using the ophthalmic or otic preparations. You want to make sure to check the expiration dates and the doctor's order 3 times before administering any medication, but in this case, we want additional checks. These points are important for both the clinical practice and for patients at home that are storing their medication, because they commonly will get them confused, store them in the medicine cabinet, and it can be detrimental. So the other thing, be sure that the expiration date has not passed, especially with ophthalmic preparations, because they're delicate and they are dealing with the delicate tissue on the surface of the eye. So it's important to make sure that your patients know that they need to stick with that expiration date. I know a lot of time patients say, oh, it's fine. It's only a couple months over, and I know I can go a couple of years, but especially in the case of something for the ophthalmic preparations, you want to really stress to them that expiration date is important. This concludes our lecture, and I look forward to seeing you soon. Have a great day. Bye-bye.